pagdating sa Hulo tsaka sa Sulu.
Oo nga.
Sa Hulo tsaka sa Sulu.
Well, masarap ang chula itom sa Sulu.
Yeah.
But other than that, I only get as much information as you guys. I haven't been in touch for a while. But
Hindi, yung isa farmer daw, di ba? Indonesian woman.
Yeah, that was the information from last night. Of course, what I even heard was that she was a minor. She was 14 or 15 years. Allow me to welcome you in your language. Good evening to you.
Thank you very much. Thank you very much. That's beautiful.
With the accent, dagdagan po na ng accent.
I can't do the accent. I'm afraid I can't do. I would not dare do that. But Master, again, thank you for joining us. Thank you for taking the time in these unusual times to join us tonight. I know you're busy. You probably have other concerns as well. But let me start off with that. Of course, Filipinos in the past 5 months are very familiar with how our world has changed in the Philippines because of COVID-19. But we also want to know how other countries and how other people are treating this issue. We're not just talking about governments, but other societies and other cultures as well. Tell us about the UK. How are people in the UK dealing with the pandemic in the last 5 months?
Thank you, and yes, I'd be very happy to talk about that. Perhaps just before I come to that, and picking up something you were discussing at the very start of the show, let me just express my sympathies for all of those who were caught up in the blasts in Holo yesterday.
Yes.
We're thinking very much of the loved ones, of the victims, and as you said in your introduction, the United Kingdom sadly has its own experience of terrorism, and we condemn all acts of terrorism anywhere in the world, and particularly after yesterday, we stand in solidarity with our friends here in the Philippines. It was a terrible, despicable act.
Thank you, sir, for your sympathies.
I mean, in relation to the coronavirus pandemic and COVID-19, I think it's true to say that all countries around the world, here in the Philippines, my home in the UK, governments everywhere are facing the challenge of an unprecedented health and economic phenomenon, which no one in our lifetime has experienced before. In the United Kingdom, we've had a significant experience of the virus. Sadly, we've had over 300,000 cases across the UK, and tragically over 41,000 fatalities.
Okay.
We have drawn enormously on the strength of our National Health Service to provide the best possible clinical care to those who have been suffering from the virus. And we have counted ourselves blessed to be able to draw on what is a remarkable public service that we have in the United Kingdom, and one within which I should say we are doubly blessed to benefit from the presence of over 16,000 Filipino healthcare professionals. So
16,000.
Over 16,000, yes. So we have nurses, doctors, consultants, specialists, all of them engaged on the front line of my country's response to the coronavirus. And we are enormously grateful for the professionalism that they bring to everything they are doing, as well as these wonderful qualities of empathy and sympathy and ability to provide emotional support to their patients.
Ambassador, I was going to ask you about the Filipinos. You have one of the highest numbers of Filipinos in Europe. How are they doing? I think there are more than 200,000 or about 200,000 Filipinos living in the UK. How are they doing in this pandemic?
So that's right, Amy. We have, alongside Italy, we have one of the largest OFW populations in the UK. We have well over 200,000 Filipinos who are living and working in the United Kingdom. They make an enormous contribution to our society and our economy and our culture. And they are a very vibrant and dynamic community that is extremely well integrated into the UK. Well, as I was growing up as a child in the East End of London, our closest family friends were the Filipino family who run a local business, and we're still in touch with them today. I think in the context of the pandemic, like all of us, that community has been affected by the economic impact of lockdowns. We've had lockdowns in the United Kingdom, akin to what you've had here in the Philippines. And people have not been able to work for some time. We're gradually reopening our economy, and the government has provided some financial support to people who couldn't work during that period. At the same time, I'm sure the Filipino community, again, like others here in the Philippines and back in the UK, would also have experienced the emotional stresses and strains of being separated from family, of being anxious for their own health and also the health of their loved ones. And as you said in your introduction, I think it's a really important aspect of the pandemic, which all of us need to be attentive to, and that's the effect it has on our mental health and well-being. And we shouldn't underestimate the stresses and the strains that the virus is bringing to our communities and society more generally. But I know, of course, in the United Kingdom, you have a fantastic ambassador, Ambassador Lagdameo, and his team in the Embassy of the Philippines. I'm sure also very engaged with the Filipino community and working to ensure that they are getting all the care and the attention that they fully deserve.
Would you know how
Ambassador,
many, would you know how many Filipinos have lost their jobs so far in the UK?
So I wouldn't have a figure for that, I'm afraid, Amy. But I would stress that during this period of lockdown, which the United Kingdom went into lockdown in March, we've progressively eased our lockdown arrangements in recent weeks because, as here in the Philippines, we needed to get our economy going again. We needed to give people the opportunity to be earning. During that period, there's been a comprehensive program of government support under a furlough scheme where they were covering the wages of people who couldn't work during that period, a range of government support schemes for the small and medium-sized businesses that were hardest hit during this period of significant economic upheaval. And, we're talking about the most acutely hit sectors as well, where we've really tried as a government to provide support: the hospitality industry, the tourism sector, similar to what you've seen here in the Philippines. These are the areas of the economy which have really felt the impact of lockdowns in recent months.
Mr. Ambassador, you mentioned the thousands of medical frontliners in the UK, for that matter, in the entire Europe, if not the whole world. We are, of course, very proud of our healthcare workers. We're also very happy for the opportunities that countries such as yours afford them. But as you are aware, it's become a dilemma for our leaders and for government, especially in the middle of a public health crisis. On the one hand, they feel that they need to keep our health workers here at home. At one point, banning the exit of nurses and doctors and so on. On the other hand, they have taken that back and they said, no, beyond a certain date, if you have a signed contract, you may go. But it's one of the major destinations for our nurses and our healthcare workers. What is your message to our government every time this issue comes up? We imagine that this issue will keep coming up.
So thank you for the question, and I should emphasize up front that the United Kingdom has no interest and no ambition in depriving the Philippines of the great homegrown medical and healthcare talent that it has. And as you say, particularly at a time such as the times we face at the moment, the people with those clinical skills, those caring skills are absolutely essential. We have been in a situation, and you described it very well, Robbie, in recent months, where alongside the understandable restrictions that the government has put in place to limit travel for those in the health care sector, there was, however, a recognition that in the UK's case, nurses and doctors who were already established in their jobs in the United Kingdom or had already signed contracts and therefore had significant personal financial commitments should be permitted to take up their roles. And we're grateful for that. But I would emphasize that clearly we need to ensure that in the present situation, those that have the skills and the experience and the empathy and the courage to do this work, because this is dangerous work that people are doing on the very front line of tackling this virus. Should be able to do so in those places where they already have commitments or they're best able to make that contribution. And there's no, this is no time for people raising issues of seeking to, on the one hand, it's been characterized as countries stealing the expertise from the Philippines, or on the other hand, as the Philippines seeking to, protect and safeguard and inhibit the travel of those who are here. I don't think those sorts of comparisons are at all helpful. We need to recognize that there is a significant group of people who are uniquely qualified to help us all at this stage, and we should work within the contractual commitments and the other commitments that they have to enable them to do so to the best of their ability.
Mm. Okay. Mr. Ambassador, Filipinos over the past so many months have gotten used to wearing face masks and wearing face shields. I'm just curious. In the UK, is it a thing for people to wear these things, or would it be like in the US where it becomes a rights issue for some people?
So it's true to say, I think, that in the United Kingdom, we do not have the tradition of wearing face masks, for example, that you see in the Philippines and actually more widely in Southeast Asia. But as we have gone through our response to the coronavirus, the government in the UK has introduced certain requirements for people to be wearing face masks, for example, when they're traveling on public transport, or when they are going shopping, or when they are in an environment indoors where they can't maintain social distancing. And I think it's fair to say that this has been a requirement that it's taken some people time to adjust to. But the government has invested very, very heavily in public communications campaign to reinforce the messaging around that. And, when you consider the purpose of wearing a face mask, it's not only to protect yourself, it's to protect the people around you as well. And my Prime Minister Boris Johnson has boiled down our public health messaging to three key words. So that's hands, face, and space. So hands in terms of washing your hands regularly for 20 seconds in hot water, protecting your face by wearing a mask, and preserving space in terms of social distance from those around you. And in the United Kingdom, we recommend that should be 2 meters, but at least 1 meter, where 2 meters isn't possible.
Yeah, Mr. Ambassador, as you are very well aware, the other side of this crisis, the other side to the public health crisis, is the socioeconomic crisis. The Philippine economy has plunged at a record rate, has slowed down at a record rate. But last August 19, the United Kingdom and the Philippines convened for the second UK-Philippines economic dialogue. Maybe you could speak, sir, on how can our countries help each other to take us out of this economic malaise?
So I think the economic dialogue, which, as you said, met just last week, its second meeting, which we did so virtually. We are all of us living our lives through Zoom and Teams and Google Meet at the moment, and the economic dialogue was another virtual discussion. Was a phenomenal meeting, which just demonstrated the extent to which the economic partnership between our two countries goes from strength to strength. Trade and investment has always been an important connection between the United Kingdom and the Philippines. Just last year, bilateral trade leapt up to over £2 billion, which is the highest it's ever been. We have many British companies already present here in the Philippines, over 200. Operating, with many more eager to come. And you go to the malls, you see the retail presence. We've got many of our consultants and other similar companies engaged in the infra program. Aviation is another sector where we are very active. So the economic dialogue is an opportunity for us to have a government-to-government conversation about keeping those trade and investment and commercial links rich and vibrant. And also comparing notes, as we were doing last week, on how we are dealing with the economic impact of the coronavirus as well. I should add, the economic dialogue goes wider than that as well, and provides an important forum where we can consider questions around the business environment. So the United Kingdom worked very closely with the executive and the legislature here in the context of the Ease of Doing Business Act. We've made significant efforts ourselves to alleviate the burden of red tape on businesses in the UK. And we were delighted to be able to work with our hosts here in the Philippines as they developed their own legislation. We have a lot to do with the Anti-Red Tape Authority. And we are eager to continue that cooperation, both to unlock still further the economic potential here in the Philippines, but also to create a even more benign environment for British businesses that should choose to operate here. And then you look at the perspective beyond the crisis as we start to rebuild our economies and we start to deliver what we hope will be a lasting economic recovery. And both for the United Kingdom and the Philippines, I think a priority, a principle which guides our approach to that recovery is ensuring that the recovery is sustainable, that it's clean, and that it's resilient. None of us have any interest in reinvesting in old technology, in coal, in energy supplies, which are not going to maintain that sustainable, clean future, which we want for our generation and for future generations. And I'm particularly passionate about that, not only because it's a long-standing priority of both our governments, but because next year, the United Kingdom will be hosting the Global Climate Change Talks, COP26, in Glasgow, Scotland, in November 2021. And we've already got a fantastic partnership with our colleagues here in the Philippines, preparing for what we hope will be a very successful climate change negotiation.
Mr. Ambassador, the last quarter, the Philippine economy contracted significantly, around 16.5%. I understand that the UK's GDP also contracted significantly, I think around 20%, thereabouts. Now, moving forward, looking at recovery and looking at the notes that have been that the two countries have exchanged in the last economic dialogue, what do you think are the lessons that we can learn from each other in terms of moving the recovery forward?
So I think if you look at both our experiences, I can speak a little bit about what we've been doing in the United Kingdom. We continue to sustain support to the companies, which are the backbone of our economy, that many of them have had no choice but to try to weather the storm during lockdowns and are now trying to rebuild. So providing financial support for those companies and their employees remains a key element of work moving forwards. As here in the Philippines, we've been trying to ensure sustained spending on infrastructure, again, to provide growth, to generate jobs, and also, to address needs that existed in my country before coronavirus arrived. We are trying to stimulate the housing market as well. We have something called stamp duty, which you have to pay when you buy a house in the United Kingdom. And the Chancellor recently announced an amnesty on stamp duty through to March of next year, which will significantly reduce the cost of anyone wishing to buy a house in the UK. And that is kickstarting our housing market. And obviously, when people are buying houses, that means others are building houses, they're kitting out the houses, they're decorating the houses. So that's making a significant contribution. And as I said earlier, we're really trying to get our tourism and hospitality sectors going again. And all of that consistent with those public health protections, which we are all learning to live with, which I think will be with us for some time to come.
Mr. Ambassador, what do you see as a trend, not just with the UK but worldwide, as the direction for as economies try to recover? The Philippines, among other things, of course, is pinning its hopes on infrastructure, priming the economy, public works, and so on. But another big generator, of course, as well, is manufacturing. But there's a lot of pressure as well from other countries to onshore and to bring back manufacturing to their own countries, because everybody needs to generate employment. What do you see as the trend in terms of manufacturing and bringing back manufacturing to your own countries? Is there a policy in the United Kingdom that you see? And for that matter, do you see a trend worldwide, whether to onshore or to offshore?
So I think it's hard to discern global trends, Robbie, in this sector already. And I think one of the characteristics of globalization is that countries, communities can play to their strengths, and for some that lays in manufacturing, some that lays in the services sector, for others that's in other aspects of the economy. I mean, one thing I think which the United Kingdom is particularly invested in, and where we like to feel that we have a well-developed sector which is globally competitive, is around digital and technical innovation. And I think one of the experiences that I take out of these past few months is how we are all of us increasingly dependent on the digital economy. And on obviously the telecommunications infrastructure that supports us. So I think in the period ahead, the United Kingdom will continue to invest, and I hope show thought leadership in these sectors around digitalization, which I think will be relevant to all our countries in the period ahead. Distance learning and digital delivery of education is obviously particularly on our minds at the moment, as our schools are not able to function as they would normally. Increasing financial inclusion through digital banking, I think, is also a key area of development for the future. And going with that, of course, are ensuring that we've all got the safety and security in place, which means that we are protected against cybercrime as our lives increasingly move online. So I think from the United Kingdom's perspective, that will be one area which we will continue to develop on, and I hope continue to show that we have expertise which is world leading.
Ambassador, at the start of the show, we were discussing the bombing in Jolo. I know that you have the UK has been a very big supporter of the peace process in Mindanao, and I also know that a lot of our terrorism law was patterned after the one that you have. How is our cooperation in counter-terrorism going? And what's the latest on your support for the peace process?
So I think this is one area where our relationship has expanded particularly dynamically in recent years. And in the field of security cooperation, including counterterrorism, the links between our two countries are richer and deeper than they ever have been. We have, for example, established a joint committee which discusses defense issues. That's meeting again in the months ahead as part of our enhanced partnership. We collaborate in areas directly relevant to counterterrorism, for example, in dealing with some of the precautions and protections that public spaces and people in the hospitality industry, for example, who have often been targeted, I'm afraid, in both our countries, can take to protect themselves and to protect their customers. And I think more generally, our engagement in Mindanao, which has always been very firm and very strong, is also expanding rapidly. So we are working with a close partner of my government, the Westminster Foundation for Democracy, on a significant project which will help to establish the new parliament as part of the Banks de Moro process. We are engaging in looking at ways that we can help support the healthcare system in Mindanao, particularly at the moment as it deals with the challenges of coronavirus. And also, I hope we'll be engaging around a number of areas to help around the political empowerment of women. And our commitment to the peace process in the South and ensuring that the BAM establishes itself on firm and durable footings is a very real one, which reflects our many years of support for all the efforts that have sought to achieve security and stability in that part of the country.
Mm-hmm. Mr. Ambassador, perhaps you'd like to give a parting message to all our Filipino viewers.
So that's very kind of you to give me that opportunity. I would just like to say that I consider myself very fortunate to be representing my country here in the Philippines. a wonderful country with whom we have such close links, which are getting closer all the time. And I often say to people that our relationship is closer than you think, closer than many people know. And we'll be able to demonstrate that even more emphatically next year as we celebrate the 75th anniversary of diplomatic relations between our two great countries. And with that, I would say thank you very much for the opportunity to speak to you this evening. And maraming salamat. Thank you.
Okay,
Thank you.
UK Ambassador to the Philippines, Daniel Pruce. Maraming salamat po. Tausog magsukul.
Thank you very much. Walang anuman. Thank you very much indeed.
Thank you.
Salamat po.
Thank you.
Thank you.
Thank you po. We will just pause for break, so please stay with us.
Welcome back to the Chiefs. We are now in the final stage of our conversation. And now we'd like to welcome Mr. Bernard Argamosa. He's the consultant in charge of the National Center for Mental Health Suicide Prevention Program. Good evening po, Mr. Argamosa. Welcome to the Chiefs.
Yes, ma'am. Good evening po. And good evening po sa mga nakikinig and nanonood po sa ating program.
Well, amid this pandemic, of course, pinag-uusapan po ngayon yung mental health ng mga tao. Maraming nadidepress, maraming nahihirapan, and even the church, government agencies are taking cognizance of it. Kumusta po yung yung suicide prevention hotline ng NCMH? And apart from suicide, ano pa po yung mga malalaking problemang hinahain ngayon sa hospital ninyo?
Laging nasa news po ang NCMH ngayon. No? So, ano po yung gusto niyo pag-usapan? But let's just stick with what, in the context of what I think the DOJ Secretary said regarding suicide. We have been operating for 15 months now, ma'am. And I can say that on the average, we receive 350 to 400 calls in a month. But during the start of the pandemic, March, April, May, June, and up to July, pataas po talaga siya to a point na nag 1,000 plus calls po kami.
Bumababa na ha?
Tumataas.
Yeah.
On average, that's on average, or that's the peak?
Mataas na mataas.
Mataas na mataas po. Double po nung aming experience ng first 8 months of our operation.
Dok, curious ako dyan. Bakit po ganun? Kasi di ba June and July medyo nag-GCQ na tayo eh. One would think, at least one would think na kahit pa paano na-ease yung pressure, pero hindi pala ganun, no?
Hindi sir. Ang nakita po naming trend is that 3 months after the announcement of the quarantine in March, slowly doubling yung rate namin. Tapos,
siguro kasi nagsasara yung mga doon nagsara yung mga kumpanya at yung ng trabaho mga tao. Diba? Well, that's just a guess.
I think you have to show the slide na may data nung months eh. Meron akong pinakitang slide dyan. multiple reasons po. I think it is the months after the ECQ nung March that people started to get really worried because this is something new. Yan, tingnan nyo to.
Ito.
May
Oo, ang
2019
steep, oh.
hanggang February, okay lang siya. Talagang yun yung average namin. But look at March, April, May, June, and July. Talagang grabe yung tawag namin. Muntik-muntikan nang bumigay yung aming system. Anyway.
Doc, linawin lang natin yung bumagsak na August yun dahil gitna pa ng August yan, hindi pa kompleto ang August.
Ayan, yan po yung maganda na nakita namin na by August ngayon, ang laki naman ng binagsak. Kasi patapos na ang August That's the August 20 data So parang ang tingin namin, slowly, hopefully, pababa na ito. Kasi now, di ba, nakadalawang ECQ na tayo, nag-GCQ na ulit, and people are starting to adjust. People are starting to cope.
Oh, so it plateaued and then it's going down.
Let's hope. Kasi
At least the initial information, at least the initial data for the first 20 months of August.
Yes. We need another 3 months maybe to see, pero nagulat din kami kasi ang laki nung binaba niya. So is it because people are adjusting or coping? Pwede.
Okay. Now, Doc, give us an idea of, I don't know if you can parse it from month to month or period to period, but give us an idea of ano ba hinaing ng mga tao? What's the most typical na hinaing ng mga tao? Is it family? At a certain point, is it about jobs? What are you hearing from our people?
I think I also have a table there. Multiple po yung reasons. Anxiety tops the list. Ayan, anxiety-related concerns. Some are calling for someone. Some needed someone to talk to. But I think it's more of the uncertainty and the anxiety connected or related to the COVID pandemic that spelled the big difference. This pandemic has affected everybody, pero most affected talaga yung special populations. Number 1, yung dati ng kliyente. Yung dati ng nagpapacheck up. Number 2, yung nawala ng trabaho. Okay? Number 3, yung mga dati nang nakakaramdam but hindi nagpapacheck up.
Okay.
And number 4, yung mga healthcare workers, yung mga na-quarantine. Yan. Halo-halo na kasi yung data namin Hindi ko na nga pinakita dyan. Yan yung mga tumatawag pa lang, sir. But I did not, hindi ko na po pinakita yung mga tinignan namin ng mga OFW sa quarantine, yung mga LSIs, mga locally stranded individuals, hindi pa yon. Is this a good thing na tumaas ang data namin? I think at some point yes, because nakita nila na that they have they saw this opportunity na matignan sila or this is for them a sign of they want help and they got it. So we're glad na kahit mahirap on our part, it's 1,000 calls in a month times 3 or times more than twice ng aming average. It's still okay. It's still good for us.
Yeah, but Doc, one premise at the time getting from the demographics that you've mentioned, yung iba na pumasok na dati, yung iba have already gotten help, yung iba na diagnosed na talaga. But I think am I right in hearing na one basic premise there is that these are people, a lot of these people are at least already aware of your services. And
Yes.
there's a very big universe of Filipinos who don't even know. I mean, at a certain point, I was going to say, at a certain point, we have to flash your numbers here on screen.
Yes.
But there's
Yes.
a very big population that are not even aware of your services.
Yes, I agree. That is why recently lang kasi namin nakuha yung 1553 short number. This is a total free call for landline to landline. Unfortunately, marami po sa amin ang tumatawag using their cell phones to the cellphone namin, hindi masyadong nagagamit yung PLDT. Which I would be, sana po, I'd be using this time to seek help PLDT through maybe the chairman, Mr. Pangilinan, to give us access, sana at least for the next 3 months during the pandemic, for our callers using cell phone to get toll-free calls to the 1553 na landline natin.
Okay. Linawin
Couldn't
lang po
that be
natin
a
yung sinabi
factor?
nyo, yung landline toll-free, mobile calls, hindi. So that's what you're asking help for.
Opo, yung mobile to mobile, yung iba kasi kumukuha no, 'di ba, may mga promos, may mga
Yes.
annuals, okay lang 'yon. Ang problema, pwede sana silang tumawag dun sa aming landline na 1553. Unfortunately, medyo may bayad kasi 'yon.
Okay.
Aside from that, sir, ang nag-step up kami. Kasi hindi kasi pwedeng kakausapin mo lang ang kliyente. Some of them will be needing therapy and you cannot do that over the hotline. That is why we tap our resources at the hospital, the guidance counselor, the psychiatrist, para yung nakita ng hotline, ma-refer dun sa telemental namin na additional platform, kaya na-check up na po sila. And nilagay ko na rin po dyan, we'll be opening our teleconsultation mismo, yung konsultasyon at the National Center for Mental Health para po yung mga gustong magpa-check up through online, dun po lahat. By scheduling din po yan.
Before the pandemic, meron na kayong problema sa sa personal, kulang na kulang, well, not only in the hospital, no, but nationwide, kulang na kulang yung mental health professionals natin eh. Kumusta yung recruitment ninyo? Dadagdagan ba? Or kahit man lang volunteer who can be trained at least to field these calls?
Yung sa hotline po namin, ma'am, I think we've been managing, okay naman kami doon. As far as the professionals, yung aming, kasi we have a psychiatric training program, nagulat kami kasi ang dami talagang nag-apply. So, okay kami doon. Unfortunately, bago lang sila. So, mga nakatatlong taon pa lang, still have to, 4 years kasi yung training, then certification exam. But the passage of the mental health bill really helped a lot. It paved the way for mental health. Dati hindi na pag-uusapan yan eh. Lalo na suicide, right? Hindi yan.
Yeah.
Very, very taboo yan. Ngayon, very open na siya.
Well,
Unfortunately,
ang dami, mga ilan yon? Ang dami yung meaning how many?
yung ano po, ma'am?
Figure. Sabi nyo, ang dami nag-apply eh. Mga ilan kaya?
Ma'am, ang residents po namin, 20 sa first year.
Oh.
Madami po yun kasi nung batch ko, mga 5 lang kami. So marami pong nagiging interested in the mental health profession. Psychiatrist talaga konti lang po kasi kailangan you have to finish you get medical degree muna, then you go to training. Mas marami po ng konti ang psychologist but still kulang pa rin po kasi medyo mahigpit ang kanilang certification din.
Pero mga mentoring program with barangays kasi sila din yung mga they're also considered frontliners, no? Hindi
Yes. Yes, ma'am.
Meron
Opo.
tayong program to reach out kahit man lang siguro around the hospital man lang, kahit pilot area muna. Meron ba
Ma'am,
ngayon?
part po nung spirit of the law yan is to community-based mental health program. Naka-align na po lahat yan, ma'am. Unfortunately, tinamaan ng COVID this year. Kaya ang dami po naming programs na stop.
Kaya lang malaki problema ngayon eh, during the pandemic. So itutuloy niyo ba?
Yes.
Tinutuloy ba?
Ma'am, we tried. Last month, we tried training yung staff namin in mental health and psychosocial support. Ang naging problema namin kasi, kailangan kasi yan face-to-face and yung isa sa amin nag-test positive. So, ang laking problema. So, we are now, ngayon yung training, we will temporarily halt it, but the processing can be done one-on-one na lang po or by group through a webinar po.
How about the church? Are you working with the church? Kasi sila din daw, sila providing spiritual counseling. Pero nagko-coordinate ba kayo?
Ma'am, yung spiritual aspect of this, wala po kaming problema dyan. Unfortunately, hindi po nakakapag, as far as I know, ma'am, kasi may sariling program po ang psychiatric and psychological services of the hospital. Sa ngayon po, wala po akong naririnig pa na coordination with them, but wala pong problema yun. Ano po to, we cannot do it alone at the NCMH. That is why non-governmental organizations who can do psychosocial processing.
Yeah, Dr. Argamosa, speaking of you can't do it on your own, and speaking of frontliners, what can we do on the level of our homes?
I always in the webinars that I engage in, I always tell my listeners that we have to go back to the basics. It is true that family is the basic unit of society. We have to yung makita nung family members that take care for each other. Malaking tulong po 'yan. And sa sa mga sa mga families nakakakita po ng wag po nating pagwalang-bahala, especially suicide. If you think nagkakaroon na ng significant changes in an individual, kapamilya mo, ask it. Yun po ang basic tenet ng in suicide prevention education. You ask. Kasi 'di ba dati ang natin is, huwag mo tanungin baka tuloy niya. Hindi po. You ask directly. Are you thinking of suicide?
Yeah,
Then
I'll get to that. I'll get to that point. I'll be more blunt about that particular concern. You're saying if we ask, hindi tayo yung nagtatanim ng isip. I mean,
Yes.
yun yung takot ng tao, di ba? Parang you're saying, hindi, harapin nyo. And wala yung pangamba na baka ako yung makapagtanim ng
Yes.
isip.
Correct. Correct po yan, sir. We ask. Hindi po totoo na tanungin natin baka mamaya gawin niya. We ask directly. Are you thinking of suicide? Then let's get help.
Okay.
But when you Doc, when you ask the question, is there anything that people have to keep in mind, or you just simply ask it out loud? I mean, kasi kahit pa paano, people will have a hard time just asking it. What would you suggest? Basta diretso na lang?
Siyempre, sir, yan? Yung any other relationship, we have to may
Pakiramdam.
viewpoint. Kasi hindi ka na kumakain. Malungkot problema, nandito ako. Then ask. Are you thinking of suicide? Siyempre, yan, sir. Kaya nga maganda rin may training. Pero, is that we had. Yun yung tinuturo nila. Don't be afraid to ask. Don't be afraid to ask. Let's just be mindful of our tone, gestures, and pakita natin that we're empathic, that we understand and care about them.
Doc, kanina kasi you were showing quantitative data on the calls that you've been getting in June and July mataas, tapos bumaba ng August. What about yung qualitative data? Nagbago ba yung the reasons that people call nung August compared to June and July, or is it still the same?
Still the same, sir. Bumaba lang talaga siya, pero hindi ko din masabi, sir, bakit siya bumaba pa kasi ang aga pa. Maybe in the next few weeks or months, we will have a comparative analysis of the trend. Sa ngayon kasi, pa lang, hindi pa katapos yung August. Nagulat lang kami kasi parang ang baba niya kumpara nung past 3 months.
Doc, sorry, medyo maliit kasi yung font, hindi ko mabasa, medyo mano. Pero so June and July nasa 1,000 yung volume niyo, 1,000 per what was that, per day, per month? Per month. For June and July. Now for the first 20 days of August, saan po pumapalo yung numbers natin?
400, nasa 400.
For the first 20 days. So 10 days to go na lang yun. Okay, it's
Yes.
that is a drop.
Parang, pag tinignan, papaba siya. Pero siguro may effect nga, sir, yung, sa akin, it's too early, but one of the possible reasons is we are adjusting.
Yeah, but
marami po dun sa initially, it's all about COVID.
Doc, what do you anticipate? Because in terms of seasonality, we are entering, I mean, not to be funny about it, but we are entering the bear months. It's a particular season for Filipinos. But during the bear months and heading into the final quarter, especially given that we expect the final quarter to be around family and a lot of reunions and so on, it's a happy time. What do you anticipate if this continues all the way to the Burr months, all the way to the Christmas season, and we are still in these abnormal times.
If you're going to look at the December 2019 data, mababa yung tawag namin. Even the suicide calls, mababa. So, is it because we are the Christmas type? We are the Christmas, we are a Christmas people? Maybe. Protective ba yung Burr months? Maybe. I hope bumaba. I hope na the season will encourage us to be happy. But we are anticipating the worst. That's why we are preparing our people na dinadamihan na namin yung platforms kasi nagsara ang outpatient namin, inopen. Nag-open na kami ng first consultation through e-consultation, and we are planning several projects in the next few weeks and months to address the mental health concerns, possible mental health concerns. Tuloy-tuloy po lahat ng programs namin for the healthcare workers, for the frontliners. I-open namin yung telemental exclusive for the health frontline. Ganun po. I hope mas umukay because it's Christmas or Burr season. Lalabas na si Jose Marichan. Hindi natin alam. So,
no, but that's why I asked, di ba? Parang on the one hand, yun din yung hope. Okay, mas malawig, mas maliwalas, your family and friends are starting to reach out to each other. But at the same time, it's going to be, I expect, a season of heightened dissonance as well. Di ba? Dahil sanay nga tayo na this is the time to be reconnecting, and yet we will not be reconnecting if we will still be under some sort of a quarantine. Isn't that something to brace for on the other side of it, that there will be that heightened dissonance? Now, usually December I associate with this. It doesn't seem to be happening this year.
You're right, sir. But I believe in the Filipino resilience. I always tell this in my webinar. Baka naman mabawasan yung lungkot natin kasi less yung gastos natin, hindi tayo makakabili, hindi ka makakapag, di ba? And you will have simple, yung mga reunion, I think ang Pilipino makaka-invento yan ng mga kakaiba na webinar reunion, so mas may excite sila, di ba? Mag-iinuman sila sa harap ng webinar, di ba?
Kaya may idea na
we have to trust the Filipino. Matindi yan. Alam naman natin yan. Makaka-invento tayo ng ways.
For example, Zoom video, okay. Di ba?
Yeah.
Something like that. Sabihin niyo si Jose Maria Chan.
Yes.
Pero expecting ko pa rin yung mga gifts nyo, at Ami. Lalo nga ikaw na Ami, expecting ko pa rin yung mga fake goods nyo yan.
Handa na yung mga cake. Doc, maiba lang ako ng konti. Still related to your hospital. You mentioned it at the start of the interview. Medyo serious yung mga akusasyon doon sa involving some of your officials, Di ba naapektuhan yung working environment doon? Parang nagiging medyo toxic yata yung patayan na yung pinag-uusapan dyan Kumusta yung mood sa yung working environment in the National Center for Mental Health?
It's really an unfortunate incident, but it's isolated. Hindi naman talaga nangyayari yan sa amin. But we are very, very sad that it happened. But alam niyo ma'am, ang concern namin yung COVID. May mga cases talaga kami among employees, among...
Yeah, you had to, di ba you had to suspend operation? Hindi, sinara sandali, di ba? The hospital?
Opo but this is the national center. Kaya kahit ayaw naming tumanggap, pag mental health ang issue, wala ho kaming magagawa. Talagang papasok sila sa amin. Imagine ma'am, we handle the OFWs in the quarantine.
Yes.
Pinupuntahan namin kahit alam namin COVID positive, nagwawala. So that comes with the job. So yun po. While we are sad with what happened, ang mindset kasi ng mga taga-mental is yung dun lang sa loob kasi nga concerned kami sa yung pasyente at sa amin. Kasi mataas ang kaso sa amin.
You have to attend to all returning OFWs, but you have to provide them counseling.
Yes, ma'am. Yung iba, ginagawa na lang kasi hindi namin kaya lahat. Ilan ang quarantine facilities? Nasa 1,000. What we do is to call them, give psychological first aid, but yung mga nagwawala sa mga ano, kinukuha namin, dinadala namin sa hospital, and at times, we give medications na sa hotel.
Hmm.
Pag hindi siya ganun
Bakit sila nagwawala? Ayaw nilang ma-quarantine or they are depressed?
yung iba po kasi ma'am, nag-breakdown na abroad.
Oh dear.
Marami
So,
po yan.
pag nila dito, may problema na sila. May mental health problem na.
Actually, ma'am, may problem na sila doon pa lang kasi marami sa kanila were already quarantined
Hmm.
there. Tapos pagdating dito, quarantine ulit. Talagang ano na.
Paano? How do you deal with that kind of situation?
Dagdag ko lang sa question, I mean, on that front, yung bang mga foreign posts natin, are they equipped to provide psychosocial support to OFWs?
I'm not that sure, sir, kasi limited. I've been in Riyadh during the 2017 repatriation. Nakita ko kulang eh. Wala naman doktor talaga tayo doon kasi bawal. And even yung mga nasa post, burn out yung mga yan eh. Kasi nakakasama namin sa mga trainings yan. Burn out talaga sila, especially sa Middle East eh. So, hindi rin eh. Kaya,
Intervention kapag ganon. Sa ganyang klaseng problema, anong intervention? Yung pwede saksakan lang ng gamot at patulugin.
we do that. We do that, ma'am. Level 4 na po yan. Pag nagwawala po sila, at may magbabantay naman sa mga hotels nila, ginagawa po namin yon. Pero ang problema namin, for example, may isang nirefer sa amin in Manila, tumakbo, lumabas ng hotel. Nalaman na nga lang, nasa Pandakan na eh. So, yung mga ganun po. But, yun talaga yung yun yung malaking problema po namin. Kasi ang laking issue po ng mental health eh.
Yes, Doc, I mean, we're almost out of time, but I just wanted to, maybe as your final point and going to that, nabanggit nyo nga yung resilience ng mga Pilipino. But a lot of people are also getting sick and tired of hearing resilience from government. It's true, we know what you're saying, but beyond the resilience of the individual Filipinos, what can government be investing more on? What do you and other mental health professionals need from our government as well? Not to put aside resilience, but let's say to further support and enhance the resilience of people.
They have to invest in mental health. This is my personal opinion. This is not the opinion of the hospital. But for me, as a mental health practitioner, I think we have to invest in mental health. We have to deinstitutionalize the process. We have to invest in the programs, preventive, promotive. Kasi ang nangyayari kasi ngayon, curative na lang eh. Hindi na nga nagkakaroon ng rehabilitative eh. We have to invest in that. Yun ang I think what the DOH can do. It will take years, but the mental health law, the passage of it is a big triumph already because it has been sleeping in Congress for 1 decade. And the passage of this in 2017 or 18 is a big step. Pero medyo nahinto siya. Kasi program-based yan eh, lalo po sa National Center for Mental Health. Kailangan mag-focus sa mga programs and not just hospitalization. Yun po.
Okay. Maraming salamat po, Dr. Bernard Argamosa ng National Center for Mental Health, particularly in Suicide Prevention Program. Sir, thank you for what you're doing.
Thank you, sir. Thank you po. And good evening.
Maraming salamat po.
Thank you.
Thank you po. Okay. Mga bare months na, no? Si Jose Marichan eh. May dudugaw.
Isang linggo na lang.
Isang linggo na lang.
Pagdating daw na September, baka Robby magkatuto yung na magiging masaya ng konti mga tao pag natuloy yung sa Okta, di ba? Na magpa-flat term.
We always hope, at the same time we're always realistic. It's two sides to, I guess, being healthy.
Yeah. You hope for the best, prepare for the worst. Okay, and that will be all for this special edition of the Chiefs. We hope to discuss it. We'll keep the conversation going. I'm Edwin Gaupan News.
I'm Ami Paminton of the Philippine Star.
I'm Robbie Alampay, and we are One News.